2024 ushered in a huge increase in the prices of medication and pharmaceutical products. And one of the first tasks on the Health Minister, Professor Ali Pati's plate, was a meeting with pharmacists and pharmaceutical companies where he promised to sign an executive order which would help the situation.
Oh wow, has the situation improved? Well, if the reference point is cost of medication, one can say it has not really improved significantly. And the reason for that is not far-fetched. One, the executive order promised had come in terms of what we have on paper. And that executive order detailed certain things that should really bring relief to the industry. For instance, 0% import duty, not only on machineries, not only on raw materials, but even on finished product for a period of time.
From January up until the end of September, there were almost 11,000 suspected cases of cholera in all 36 states in the country and 359 deaths. Lassa fever was an ongoing concern throughout the year, with 191 deaths from over 9,500 cases, most of them from endemic areas like Bauchi, Ondo, Taraba, Ebonyi, and Enugu states. On the bright side, Gavi, the Vaccine Alliance, donated 846,000 doses of R21 malaria vaccines in the first instance to the federal government as an adjunct to other proven methods of reducing the malaria burden. Also, as part of efforts to mitigate the spread of Mpox, which the World Health Organization had declared a public health emergency of international concern, the United States Agency for International Development, USAID, donated the first batch of 10,000 Mpox Jynneos vaccines to Nigeria. Nigeria also became the first country worldwide to introduce a groundbreaking WHO-approved 5-in-1 meningitis vaccine, MEN5CV, with the potential to reduce the case fatality from the current 50%. According to the Minister of Health, more Nigerians enrolled in the National Health Insurance Program over the past 1 year than any single year since the program began.
We've seen more than 10 million Nigerians receive critical services in these primary healthcare centers over the last 1 year. We've seen increase in antenatal care. We've also seen increase in skilled birth attendance. We've seen more than 2.4 million Nigerians have now been covered by health insurance, bringing Nigerians that are health insured to 19.6 million. That's really good progress, but this is just 1 year.
A major achievement in the private sector was the first set of bone marrow transplants performed by the Sickle Cell Foundation Nigeria in partnership with the Lagos University Teaching Hospital. The life-transforming operations were on a 7-year-old and a 20-year-old patient.
For me, this encapsulates the essence of how this mother feels. The joy on her face when I see her speaks volumes. And one of the things she also says is her child is 7 years old, by the way, is now putting on weight. And they have to be careful that they don't give her too much. She's doing very well, so to speak.
There were rumbles of discontentment in the health sector. Several warning strikes showed employees were not happy with their take-home pay. At 1.23 trillion naira, Nigeria's health budget in 2024 was less than 5% of the total 27.5 trillion naira national budget. Mary Alale Yusuf, Channels Television News.